So, Dr. Perlmutter, one of the other common things we see here are people who present thinking they've got carpal tunnel, but their numbness is not in the median nerve distribution or along the carpal tunnel. It's on the opposite side. It's going down the pinky primarily. What do we have going on there?
Sure, and it's probably the most common thing we see in the elbow, isn't it? So there's several nerves in the hand. There's three actually. Two of them control feeling on the palm of the hand. The carpal tunnel are solidly and only these three fingers, and this half, or the thumb half of your ring finger. In most people, the pinky half of your ring finger is a completely different nerve, and your pinky is always that same different nerve called the ulnar nerve. It's called the ulnar nerve, or the funny bone, which comes from the inside of your elbow and goes down your arm and then controls again the pinky and the pinky side of the ring finger.
Right.
So if you have the way to differentiate that is if you have any numbness in your little finger, it's coming from either the funny bone at the level of the elbow. More rarely, the nerve can be hurt here, and that's usually in the mechanic that uses his hand as a hammer, right?
Right.
With direct trauma to the nerve right here. Otherwise, it's pretty rare. Way more common at the elbow, at the funny bone level of the inside of the elbow, and even still rare, a pinched nerve at the level of the neck. Not at all common that we see. So your treatment options for the ulnar nerve, that's if you're coming to me with numbness, is the first make a really solid diagnosis, because that nerve doesn't just give feeling in this part of your hand. It also controls most of the muscles in your hand and all the muscles up here in the forearm that help you make a tight grip.
Give you grip strength, right?
Give you grip strength. So often patients come to us not with numbness as their primary complaint, but they can't put their earrings in or hook a bra strap or hold change. They're dropping things. And it's usually because of the muscles in their hand, because there's muscles in between all these bones, and they control a lot of fine dexterous motion.
Well, and in fact, we call this tardy ulnar nerve palsy, right?
The formal name of it, if it's been ignored for a while, has the word tardy, which means late, built into the formal name of it. Tardy means late. Ulnar nerve is the irritated nerve at the funny bone level of the inside of your elbow. And palsy is an old term for an irritated nerve, like cerebral palsy or Bell's palsy in a face. I think if a new nerve disease came out today, it wouldn't be called a palsy.
Sure.
But tardy ulnar nerve palsy is usually because of a pinching of the nerve on the inside of the elbow, or a ligament that holds that nerve behind this bone here is torn, and the nerve can be unstable and get irritated.
Okay. So if you're having elbow issues that are radiating down into your hand's numb and you're not certain what it is, specifically if you're having numbness anywhere, don't hesitate to call us at Carolina Regional Orthopedics, and we'll be glad to give that a definitive diagnosis.